Hey all, this is another bonus episode that's part of our Greatest Hits collection, where we're replaying episodes from the previous 6 years that are just as relevant today. This one was an exclusive interview with Deborah Di Sanzo, president of Best Buy Health. It was episode number 268 and it originally aired in May 2023. Deborah detailed the three components of Best Buy's vision for enabling care at home, the extra training that Geek Squad members undergo to set up health tech in your home, and the value proposition to provider organization partners and consumers. After speaking with Best Buy's Chief Medical Officer, Dr. Z, on our most recent episode, we thought it would be an interesting tandem to hear this one again and see how their vision has expanded in the last 18 months. Take a listen and let us know if this one hits differently after hearing what Dr. Zaniello had to say in episode 343.
The show is here. Yo, our mission is clear. It's time to change healthcare. Have no fear. Today is the day. This is the hour. Together, you know we've got the power. Drop the silos. We're all the same team. Experience, business, tech, and marketing. How can anyone be satisfied with the way things have always been? Yeah, we tried. So join us now. Join the revolution. Consumer first health is the evolution. Status quo, more like status no. Yeah, this is the healthcare rap. Y'all come on, let's go!
New choices, new platforms, new care models. In the healthcare of tomorrow, consumers win. But who will design it? What will it look like? And how long will it take? We're here to answer those questions with some provocative thinking about how to create the healthcare that people actually want. Ready to roll up your sleeves, look at the world a little differently, and explore the frontiers of consumer health together? Join us. This is the Healthcare Wrap.
Welcome back. I'm Jared Johnson from Shift Forward Health, and here's what's going to go down today. We have the flavor of the week about CVS's Healthy Aging Report. Life after 65 represents a new chapter for many. So will it also represent a new chapter for consumer-centered care? And what is retail's role in caring for aging Americans? I'll talk about that. Then I'm honored to welcome Deborah Di Sanzo, president of Best Buy Health. In this exclusive interview, Deborah details the three components of Best Buy's vision for enabling care at home, the extra training that Geek Squad members undergo to set up health tech in your home, and the value proposition to provider organization partners and consumers. There's so much to talk about, so it's time to dive right in. Are you ready? Let's go.
Flavor of the week.
CVS's Spring 2023 Health Trends Report focuses on healthy aging, and it's worth digging into for two reasons. One, it describes the demographic changes that are coming on the short-term horizon as we see a greater percentage of the country's population being of retirement age. And two, it lays out the role for retail health in addressing the needs of this aging generation. So what are those demographic changes, you ask? 1 in 5 people will be of retirement age by 2030. Despite their relative health, 3 out of 5 people over 65 are managing 2 or more chronic conditions. So they're more likely to spend time at hospitals and have more needs at the pharmacy counter. To serve older Americans means rethinking the tools we already have and innovating where new needs arise. A theme of the CVS Health Report is how to reinvent care for a generation, meaning that serving Americans over 65 will call for industry-wide innovation and a sensitivity to how they want to receive their care. It dives into 5 strategies for better support of older adults, putting self-advocacy first, improving home-based care, leaning into virtual care, using prescriptions as an opportunity, and increasing convenience. It then describes retail health's role in an aging America, claiming that neighborhood health destinations will be as important as virtual care and home health delivery when it comes to caring for older adults. The report explains that visits for patients over 65 include use of the age-friendly health systems framework known as the 4 M's: what matters, mentation, mobility, and medication. In practical terms, a provider using this framework aims to align care with the patient's health goals and care preferences, what matters, address mental health and cognitive skills, help them maintain function and mobility, and use only age-friendly medications that don't interfere with what matters, mentation, or mobility. The report points out that more than 465,000 Minute Clinic patients have received this kind of care. That's nearly 500,000 patient encounters in 2.5 years. Life after 65 represents a new chapter for many. Will it also represent a new chapter for consumer-centered care? Thus far, we've largely addressed older health consumers' needs by telling them to learn how to navigate the system better. But why not create a simpler system in the first place? Do we think consumer-centered innovation is really just for younger patients? It's time to build up our consumer muscles, not just for ourselves, but for those who preceded us, so that we can honor the lives that they've led and create a healthier society. Let's start by changing our paradigm. That's another way that we'll build the healthcare of tomorrow. And that's the flavor of the week.
flow, the flow, the flow.
All right, everyone, let's get into the flow. I am so excited for today. Please give it up for Deborah Di Sanzo, the president of Best Buy Health. Deborah, welcome to the Healthcare Wrap.
Jared, thanks so much for having me.
We are truly honored to have you on the show today, Deborah, and I can't wait to dive into a lot of what's happening. I was fortunate enough, I'll tell you, to be in one of the sessions that you've presented recently. It was at Vive with Dr. Rasu Shrestha, and I'm not even joking. I came away from that just feeling more encouraged than I've felt in a long time about healthcare, and I'm excited to dive into that with you. But let's start with a little bit about you. It's wonderful to be able to give our listeners even a little bit more about yourselves. Let's fill in the blanks a little bit on your bio. What else would you like our listeners to know about you and your background?
So I've been doing this for about 30 years at the intersection of healthcare and technology. I spent 12 years at Hewlett-Packard when Hewlett-Packard had a medical products group, 14 years at Philips. I ended my career at Philips as the CEO of Philips Healthcare. I then had the distinction of going to IBM and running IBM Watson Health. And I'm very happy to be at Best Buy Health right now. One of the things, sort of fun, I am a master in the Korean martial art of Tang Soo Do. My daughter and I started that together when she was 6 years old, and we went right through. So that's a little bit about me.
That's amazing. Okay, so if I'm not as familiar with that art, how is that different than other martial arts?
It's a Korean martial art, very similar to Taekwondo. They were started at the same time. Taekwondo is a little bit more in the kicking. We are very even between punching and kicking, if you want to know that, but very similar to Taekwondo.
Awesome. Okay, I know what I'm going to be YouTubing tonight to learn more about that. Outstanding. One thing we've been asking guests recently is a piece of career advice that has stuck with them, just something that they feel like has helped guide them along their way. Is there something that comes to mind when I ask, like, what's one of those pieces of career advice that has just stuck with you over the years?
Yeah, I love this question. I want to go back and see all the answers to this advice that you got, but immediately came to me. I had a general manager. He was actually the general manager of the Hewlett-Packard Medical Products Group, who told me that I needed to be in it for the long run. And what he meant was, I was running really hard, and he meant, resilience is important. It's important in your health. It's important in your mental health. It's important in your body. It's important in your vision. And it's really important also in what you're trying to do for your business. As you go through business, as I've gone through these past 30 years, trying really to bring the consumerization of healthcare to life, you go through ups and downs, and you really have to stay with your vision, stay with what you want to do in this world, and you need resilience. So you have to be in it for the long run.
I love that.
I think of that all the time. I think of it particularly when business has ups and downs. I think of it in the downs. I also think of it in the ups. You have to be in this for the long run. What are you doing in the long run? And it's very important now too, as we're all in this hybrid world, and it seems like we're even more busy in the hybrid world, have to be in it for the long run.
So true. It's so true. All right, Deborah, let's dig in here a little bit. Can you give us a layperson's description of Best Buy Health and how you've approached your healthcare strategy to this point?
So if you think of it, used to, I don't get it so much, but when I joined Best Buy and I told people that I was the president of Best Buy Health, people would say to me, what the heck is Best Buy doing in health? It's a good question, but think about Best Buy, right? Amazing omnichannel retailer and consumer electronics, superb supply chain. And we have Geek Squad. So Geek Squad has been helping people with technology for years. When we did the strategy, which think of the strategy was done at the end of 2020, we were in the middle of the pandemic. Telehealth had come to be. Really, we're finally seeing the consumerization of healthcare. And we said, if Best Buy is going to be in health, it has to be with Best Buy's capabilities and assets. So Best Buy Health, our big goal is to enable care at home for everyone. What does enable mean? Enable means, using Best Buy's capabilities in omnichannel logistics and Geek Squad, our caring centers, and our current health platform, really to smooth out the path from the health systems to the patient or the caregiver to their mother or their dad or the payer to their member. So enable care at home for everyone across wellness at home, aging at home, care at home, built on top of Best Buy's capabilities in omni-channel logistics, Geek Squad, caring centers, and platforms.
That's really interesting. Was there a reason, if you don't mind me asking, why you determined that these are the spaces that make sense for Best Buy to dive into, like aging at home or just some of the other home-based care over other types of service lines that maybe other entities are providing? Is there a reason why? Like, is it just because these align naturally with Best Buy's strengths and existing assets? Or I'm just curious.
Yeah, so we're going to start with that word enable. When I said enable care at home for everyone. So we don't deliver care, we enable care, and we enable the technology, really, if you think about it. So wellness at home fits right into what we do in our omni-channels. So our amazing merchants are now really merchandising and assorting all sorts of consumer wearables, consumer health products, anything that you would think in digital health, really from monitoring to sleep to hearing to baby. And that's really when people engage in health at home first. They typically engage when they're healthy now or well and they want to stay well. And then aging at home. Best Buy Health was actually started in 2018 on the thought that Best Buy could make a difference in aging at home. So Best Buy bought, 3 amazing companies that were focused on aging at home. And we have our flip phones and our smartphones that are designed with seniors in mind. Bigger numbers, hate to say it, but bigger numbers do make a difference. A simple button to get to urgent response. Those connect to actually about 1,000 caring center agents who are here in the U.S. who do lots of things for our consumers. We take 10% of our 9 million calls a year, our urgent response, but then the other 90% are, I'm lonely, I want to talk to someone. I want to talk to a social worker. I want to talk to a care advocate. I need a Lyft ride. I'm in our social determinants of health work. We work on food and heat and anything that people need to be healthy at home. And then really the enabling care at home part is right on our strengths of care at home, hospital home. That's a logistics issue. And we knew that we could bring logistics to care at home. So it's a little bit of what people need today. They need to be well in their home. They need to be cared for in their home. They need a hospital at home. And it matches up with our core competencies.
I love that. I love hearing how that all aligns for everyone's benefit here. Maybe we can drill down on the health at home, this vision that you have for it to begin with. Like I said, I heard you and Dr. Shrestha from Atrium Health refer to it as the dark side of the moon, health at home. And they had the whole Pink Floyd analogy, which I loved, quite frankly. But maybe you can describe that, and explain what that was referring to and what that vision is for health at home.
So I'm very happy to. So Dr. Razoo he's a Pink Floyd fan, I want to say, but we started talking about this partnership. Razoo was the first person that called me when I was announced as president of Best Buy Health. And he said, I think that there's a partnership that we can make here. So we started talking 2 years ago. And in our first steering committee meeting and talking about this partnership, the team talked about how from a caregiver side, from a clinician's point of view, really what happens in the home is the dark side of the moon. When a patient is in the hospital, the amazing Atrium clinicians know what's happening with the patient. They have the monitors there. They have everything around the patient. The nurses are there. The clinicians are there. Once the patient goes into the home, we don't know. We don't know, are the medications being taken? Are we monitoring our health? What's happening? And that can really affect outcomes, really can affect whether you have to bounce back into the hospital. So the dark side of the moon, we talked about the home being the dark side of the moon. And then really together, how can Atrium Health and Best Buy Health combine technology with empathy to smooth out the road and the path for care at home?
That's amazing.
Stay tuned for more provocative thinking after the break.
Consumer demands, disruptive technologies, and AI are shaping healthcare for years to come. On the Hello Healthcare podcast, we dive deep on these issues with leaders who are driving change. These stories will inspire you to create and demand a better future in healthcare. Learn more at hellohealthcare.com. And now, back to the show.
Just seems to have a lot of implications. And the amount of times you keep referring to the health and wellness of consumers is really encouraging to me. It's part of what I feel like is going to, I'll use that word enabling. It's what's going to enable us to get to a better place as an industry and as a society. One part of that is understanding what that value proposition is for the organizations that partner with Best Buy, and then the value proposition, like what connects, what's attractive to a consumer of any of the services that you just mentioned. So maybe we can take those one at a time, and we can start with the value proposition for the healthcare organizations that you're partnering with. We mentioned Atrium Health, for instance. There are other health systems I know that the Best Buy is partnering with. How do you kind of address that, and what is that value proposition? Like, what benefits are there to partnering with you?
Absolutely, George. So when some people think of virtual care or telehealth or hospital at home, chronic disease management at home, you might think of, there's a patient, there's a computer, and there's a physician or nurse on the other end. But when we think about it, we really think of a logistics problem. Because if you think about it, if you are going to care for a chronic disease patient who was just in the hospital, has gone home, and you want to illuminate that dark side of the moon, you need to curate the right set of remote patient monitoring devices. You need to get them to the home on time. They can't be, in the case, it's not a pair of shoes, right? Can't be 2 weeks late or 3 days early. You need to get them there when the patient is there. And then you need to be able to take them into the person's home and train them. I don't know if you've ever tried to, if 4 or 5 or 6 remote patient monitoring devices have showed up at your home and you had to take them out of the box yourself, and you had to put, batteries in them, and you had to make sure they worked. But that's what Geek Squad does. So we take the health systems, Ascension, for example, we'll curate the set of devices that they want for a particular patient. We kit them. That means we take them out of the packages that they come in. We put the batteries in. We make sure they work. We ship them to get to the home when they're supposed to. If needed, a Geek Squad agent will meet the shipment. We'll take them over the home, and we make sure they work. We make sure they connect to the current health hub, and we make sure that the patient or the consumer and their caregivers know how to work them. Then we make sure that they keep working. All that monitoring then, connects through our hub into our system, into the command center, and then back into Atrium's electronic health record. That doesn't even sound simple. Somebody might think it's simple. It had been an afterthought. And, when we look at this is simply what Best Buy does. I do not want to liken Enable Care at Home to installing a home theater or installing anything else that you need installed in your house. But Best Buy literally has been doing that type of work for, decades. Now we take our expertise really to the home for health at home and logistics and operations and just training and helping people with their technology.
That just has to be such a big, important part. I think we can't overstate that enough, because I'm thinking of a frontline clinician, a care team member who's being asked to all of a sudden learn health at home now as part of their regiment, and on top of everything else they're doing, on top of everything else that is burning them out, and being told either to figure that out, or how we're leaving that would be to say, we've got a partner that's going to help not only explain all that, but make it possible to truly enable everything.
Exactly. When we started to put this strategy together a couple of years ago, and we were talking about what people were doing. Remember, we were right in the middle of the pandemic, and lots of hospital at home programs were starting, and we'd say, well, who is taking care of the technology? And the answers we got were physicians. We had one system, their physicians were outside in a tent, taking the blood pressure cuffs out of the packages, putting batteries in, doing their own instructions for use for all this. Another organization told us the nurses were doing it. Another organization said that the patient is doing it. Physicians don't have time. Nurses don't have time. Patients have to care about, getting well, not dealing with the technology when they're sick. So I think this is a real value proposition, and it's right in Best Buy's core capabilities.
Yeah, I see that now. Well, let's take the flip side of that. So the value proposition, if you will, for the consumer, this, I imagine, has to do with explaining how this can improve the experience, make things a little simpler, a little less daunting, a little less scary for them. Is it along those lines? How do you explain to the consumer when you come into the home and explain, hey, as a patient, like this is how this is going to make your life easier?
It absolutely is. And across all three of our carriers, aging at home, care at home, and wellness at home, it really is about, helping the patient or the consumer with the technology so they can care about their health or their wellness. Focus on what you need to focus on, and we'll take care of the technology for you. What we learned in the pandemic, and really what everyone learned, is that finally, after a decade, the consumerization of healthcare is here. Consumers know that one of the safest places that they can be is in their home. They know that I need to take care of my health 365 days a year. I'm responsible for it. I'm going to do it with technology. And then if you look across our three focal areas, wellness at home, hearing aids, for example, went over the counter in October. And not only did we assort hearing aids in our stores, but we now have hearing assessments in 600 of our stores. And we have Blue Shirts, the amazing Best Buy employees that help someone who's interested in a over-the-counter hearing aid. How do the different ones fit? What level of hearing are you at? So there's a little service. It's not just here, come into the store and look at the hearing aids on the shelves. That's important, but there's a little service to help understand the technology. In aging at home, we really like to think that we are the backup for the caregivers. Typically in aging at home, the caregivers are a son or a daughter to their older parent. And so our caring center is there 24 hours a day, 7 days a week to pick up the phone, take urgent response, provide care advocate support, really provide any support, technical support, any support that the member needs. Again, helping with technology or just helping with connecting. And then finally, as you say, for care at home, if you are in a hospital at home program or a chronic disease management program or even a clinical trial program, you want to focus on your clinical trial, getting better, starting to practice your healthy habits. You don't want to be messing with the technology. You want the technology to work. The technology should just work. And that's what Best Buy helps you with.
I love that. I guess it just comes into play in terms of one-to-one experiences. One Geek Squad member or a couple, coming into the home, working with one consumer, one family at the very least. It's in those little one-on-one interactions where that simplicity is being felt and experienced. Like, are there other skills? Like, are Geek Squad members having to be upskilled a little bit? Are they having to be trained on this? Or it sounds like it kind of works into other training that they already have. But are you finding that, is that a challenge at all, or is that working out pretty well?
Really good question. I want to start to answer this with our purpose, so Best Buy's purpose is we enrich lives through technology. And then in Best Buy Health, we just added 2 words to that. We help save and enrich lives through technology and meaningful connections. So what you're really talking about, Jared, is the meaningful connections. I'm going to step away from Geek Squad for a moment. I'll come back. I'm going to step to those 1,000 caring center employees that we have. We give them training and what it feels like to age, what it feels like. We use VR to teach about, how it feels to onset of dementia and the, activities that's going on around you. We give empathy training because if one of our consumers calls in and needs help to drive somewhere or help to walk somewhere or is a little disoriented, how do you walk someone through that? So we our caring center agents all get empathy training and training in assisting people who are aging at home. for Geek Squad, for our Care at Home program, we took the highest level of Geek Squad agent. Of course, we were training them on the health devices. That's important. We're training them on how to connect the health devices, just as we would for any technology. The Geek Squad agents also went through empathy training and also went through, what it's like to go into the home of someone who's in a hospital at home or chronic disease management program. So they are Geek Squad agents who have done other technical things before. They opted into the Best Buy Health program, and it's meaningful work for them, and it's working very well for the patients that they're helping.
What about inside a Best Buy store? I'm thinking kind of the other side of this in terms like, what does health at home look like inside a Best Buy store? Is there a dedicated section where some of this education is taking place, or does it kind of fit within the rest of the retail footprint there? I'm just curious what it looks like.
There's a health and wearables location in all of our stores, and the 600 stores that have over-the-counter hearing. There's a place for hearing assessment. But if you think of the store is going to look like, it's assorted much the same way that the rest of the store is assorted. It's there so someone who knows, I want to buy a patient monitor, I want to buy a baby monitor, I want to, buy something to help with my sleep. It's going to be set up so that when you walk into the store and you can find what you're looking for. It's assorted the way we know how to assort digital electronics at Best Buy.
Oh, very nice. Very nice. Well, is there anything else you can share about where Best Buy plans to focus during the next 6 to 12 months, for instance, kind of the short-term future in healthcare?
It's easy to sound like we have all of this, nailed down, but we're just at the beginning. We are right at the beginning. So we're going to expand our partnership with Atrium. So important because, we enable care at home. We don't deliver it. And our hospital at home clients are asking us for, what's the best protocol for this? And that's really where Atrium comes in. The protocol is what's worked. Atrium actually runs the largest hospital at home program in the country. So how can we learn from Atrium, develop our technology and tools together, and then really expand that beyond Atrium to other customers as well? We want to expand our chronic disease management program. In our aging at home business, we're focusing even more on our unique services. I mean, once you get into the caring centers, there's just a lot of services that we do deliver that we want to expand and introduce even more.
Very cool. Very cool. All right. I'm going to bring this a little more personal, Deborah. I think what we've seen with other CEOs and executives that we've brought on the show is that many of them have a personal passion. They have a reason for being in this industry. This industry is not easy. It's not for the faint of heart. We all know that. And it just takes a little extra some days to be able to say, remembering that why, if you will, of why are we in this space to begin with? Is there anything you can share about what motivates you to change healthcare and why you are where you are right now?
When I started my career, I was working for a startup that got bought by Hewlett-Packard. That's how I ended up at Hewlett-Packard. And we had created really a first-in-the-kind telehealth solution for, at that time, it was the University of Pittsburgh. And we networked 250 workstations across 7 hospitals to help neurophysiologists be able to be at every single neuro operation via telehealth. So we hooked the Hewlett-Packard patient monitors up to the system. It was a long time ago, but artificial intelligence is old, and we did an AI algorithm and evoke potentials. And it was very slow, but we reconstructed CT images into a 3D image, and it enabled the neurophysiologists to really be there. There were only 12 of them, and there were multiple operations going on at once, so they could be inside the room. It was an amazing set of technology for the time. But the thing that stuck with me is when we launched it, they invited me into the operating room. And I was a tech person. I didn't know what was going to happen. I'm going to be in a 12-hour brain surgery, and am I going to pass out? Am I going to some other way embarrass myself? But as I was sitting there, and this was early on in technology for healthcare, but as I was sitting there, and I was watching the anesthesiologist and the surgeon and the nurses and the neurophysiology, and I saw everyone interacting with the technology, I was struck with, wow, this is really helping that neurophysiologist, the surgeon, the nurse. This is a lot better use of technology than anything else I can think of. And I said, then I'm going to do this for the rest of my life. And I have. And it's taken me through just an amazing career where we put automatic external defibrillators in public places. We took the wires off of patient monitors. We did a lot in artificial intelligence, still a lot to do in artificial intelligence, but there's just so much good that technology can bring to healthcare. And I have wanted to do that my whole career, and I still want to do it.
I love it. What a perfect place for us to wrap up, Deborah. It's been such a pleasure to speak with you today. Before we go, what's the best way for listeners to connect with you?
Oh, sure. So they can find us either on bestbuy.com. They can find us on LinkedIn. Best Buy Health is on LinkedIn, and Deborah Di Sanzo on LinkedIn as well.
Well, thanks again. That's a wrap for this episode. I have had the absolute pleasure of speaking with Deborah Di Sanzo from Best Buy Health. Thanks so much for joining us today. Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.